22nd February 2021, Honorable Haruna Michelia led committee was at the National Institute for Pharmaceutical Research and Development (NIPRD) on oversight function of members. The DG NIPRD, Dr. Obi Adigwe, addressed the committee members of the press of his stewardship. Unlike most oversights where DGs are met with hardball questions, this didn't happen, but a ray of commendations were poured on the director Dr. Obi Adigwe and the entire staff of NIPRD for the tremendous shift towards attaining affordable health system in our nation.
On behalf of the management and entire staff of the National Institute for Pharmaceutical Research and Development, for all except one of you, this is your first visit to this establishment, and we would like to use the opportunity to apprise you of some of our previous achievements, as well as some of the work we've done since COVID began. But first, we want to commend your continued leadership and strident efforts in the healthcare sector, and particularly for the COVID-19 response. Honorable Chair, during your statement, you had enlightened us about the three key areas where the National Assembly was meant to provide value to national life. The area of representation, appropriation and oversight. Honorable Chair, in line with the representative activities of the National Assembly, I'm pleased to inform you that based on comprehensive and rigorous engagement by the National Assembly, we have currently trained phytomedicinal practitioners in at least 10 states across the Federation. Every geopolitical zone in this country has been touched, and we plan, with the support of the National Assembly and with the appropriate funding, to do this in the entire 36 states of the Federation. And as you're aware, even though the representation is your responsibility, you need agencies like the National Assembly, the National Institute for Pharmaceutical Research and Development, to enable you to touch the lives of the people who you are representing. And the preliminary evidence from these phytomedicinal practitioners that has touched close to thousands of healers and phytomedicinal practitioners across Nigeria is evidence that this partnership is working. Similarly, Honorable Chair, based on your intervention, I remember very fondly when the COVID pandemic started, just like one of the honorable members mentioned downstairs, I had a meeting with the Right Honorable Speaker of the House, and I was wearing my mask the same way I'm wearing it right now. And just after I began my pitch, he said, can I see your face? And immediately he saw my face, he said, DG NIPRD, your case is made. And I want to appreciate your committee for aggressively and comprehensively following up on that leadership directive to the very letter. Based on the appropriation efforts, for the first time in the history of this institute, we got a multi-billion naira subvention, which we have begun to put to use. Honorable Chair, Honorable Vice Chair, other honorable members present, you are now completing the circle today by undertaking this oversight visit, and I'm sure myself and my staff will provide you with all the relevant support that will enable us to take this partnership to the next level. Honorable Chair, NIPRD was established with the primary objective of enhancing the development and commercialization of pharmaceutical raw materials, drugs, and biological products from our indigenous resources. And we're also mandated to engage in activities that relate to capacity building, policy making, data collection, drug distribution, and the development and maintenance of contextual partnerships that can expedite much needed access to healthcare for our people. In achieving these objectives, a significant number of international accreditations and certifications have been attained by the Institute. These include the ISO 9001, as well as the ISO 17025, which we were the first institute in this part of the world to get both accreditations. Consequently, our work has been globally recognized and we've been awarded a Center of Excellence designation by several international bodies. As you're aware, just like you mentioned, Honorable Chair, last year caught many people unawares, and during the 2020 calendar year, following our engagement, NIPRD made considerable contribution to the COVID-19 pandemic response, both within the country and internationally. For instance, NIPRD provided the internationally acclaimed analysis that underpinned government's categorical position on the COVID organics preparation. That work went viral internationally with scientists and policymakers around the world referencing NIPRD's seminal work on the product. Honorable Chair, Honorable Vice Chair, Honorable Members, it would surprise you to learn that based on that seminal piece of work, Nigeria, using NIPRD's expertise, ensured that thousands of lives were saved across Africa and millions of dollars were conserved. That is the power of what this kind of institute can do when it is supported by people like you. Similarly, Honorable Chair, NIPRD advocated for the indigenous manufacturing of hand sanitizers from locally sourced raw materials. We concept produced this brand and went ahead to share our formula with other local manufacturers. That was one of the reasons why you didn't see the kind of empty shelves in Nigeria that was seen in Europe and the Americas. We've consequently helped in monitoring the quality of hand sanitizers so that we are sure that our people have the best at every possible opportunity. NIPRD has also been involved as either a sponsor or a technical partner to several relevant randomized control trials. In fact, if you go to the platform where RCTs are maintained by the WHO, you see one of NIPRD's submissions there. And this is aimed at ensuring that the highest quality of science is maintained when we are bringing interventions to the fore for COVID-19. Furthermore, sir, NIPRD leveraged on its reputation as the first African institute to develop a world-class phytomedicine from drug discovery up to phase 2 clinical trials to begin to work on repurposing our product called NIPRD. This flagship immunomodulatory agent we identified at preclinical tests to have various activities which match some of the symptomology of the COVID disease. For instance, we found that it had an effect.
The chairman and the members of the committee promised to help speak for more funding for the agency, build better synergy with other collaborative agencies in favor of NIPRD and Nigeria. No doubt, NIPRD research analysis is one of the main reasons the fight against COVID-19 is successful.
Now, coming on to what this committee is all about, you remember towards the end of 2019, I think it was the last 2 weeks, some people were discovered to have some peculiar illness in China, pneumonia, and within 3 weeks, the WHO and scientists have discovered that it was being caused by a virus, which is a cousin of coronavirus SARS-1, which was something that was discovered in 2003. But this time around it's slightly different from that one, and they named it SARS-2 or COVID-19. Now, at that point, what they discovered was that this virus was spreading very fast. And by February 27th, we had our index case in this country. But as National Assembly, we didn't wait for the index case to come to Nigeria. In fact, Didi, if you remember, the Speaker invited the Federal Minister of Health and all her MDAs to brainstorm on the way forward. At that point, we were even thinking of sending people to China to find out what's going on. And before we knew it, we had our index case. Within few months, the Speaker found it necessary to have this committee in place, mainly to add value and support the PTF, which was established by the President, and we are to also act like a liaison between the PTF and the National Assembly, PTF and the general public, and to ensure also that the people in the front line, like you people, are well protected. Finally, we should also ensure that we do oversight function on MDAs that are intervening in COVID mitigation. Now, the whole history is already in the public domain, but we know that from that period, COVID spread like wildfire, and it was named pandemic not long after it was discovered. And as at yesterday, when I was preparing to come here, I cross-checked the latest figures and I discovered that so far we have 111 million cases, in fact 111.7 million cases all over the world, with 2.473 million deaths across the world, 86,904,000 and some cases of people that have recovered, while about 22.3 million active cases. In Nigeria, so far, people that have been tested for this are 1.44 million people, and 151.55 have been tested positive, while 21.6 thousand active cases spread across the country. Unfortunately, we've lost 1,831 as at yesterday. I'm sure the figure will change today.
Grant Moke, Voicetv, Nigeria.